What's up everyone, it's Danny with Emergency Office Hours, and today I wanted to talk about hyperkalemia. Before I get into it, don't forget to check out our official website, TikTok, and Instagram accounts for more learning resources. Let's get started. Hyperkalemia is a type of electrolyte derangement involving potassium. If you look at the CMP or BMP labs of a hospitalized patient, a normal potassium level will be between 3.5 and 5. Anything higher than normal indicates hyperkalemia and is commonly seen in your kidney disease, kidney failure, and dialysis patients. Kidney failure and the need for dialysis are major risk factors for hyperkalemia because these patients cannot engage in the normal control mechanisms of the body. Potassium is excreted through the renal system. Anytime you have decreased or loss of function in your kidneys, potassium can begin to build up in the blood. This means if your kidney function labs, like your creatinine, BUN, and eGFR are abnormal, it will be a good idea to keep a close eye on your potassium level as well. The major problem with hyperkalemia is that it interferes with the electrical conduction system within the heart. Your heart relies on a healthy balance of potassium and sodium to properly contract and circulate blood. Any disturbance to this level of potassium, like with hyperkalemia, poses a risk for arrhythmias and even lethal rhythms like pulseless ventricular tachycardia. At lower degrees of hyperkalemia, like a potassium of 6, you may note peaked T waves. These are just abnormally tall T waves. As the degree of hyperkalemia worsens and you pass potassium levels of 7 or 8, you can encounter prolonged PR intervals and wide QRS complexes, which can cause issues like heart blocks. If the degree of hyperkalemia worsens even further, you can lose your QRS altogether and enter a lethal rhythm. When hyperkalemia is detected, timely treatment is necessary due to its risk for patient safety. Although the primary goal is to remove the potassium from the body, like with dialysis, or through the GI tract by administering medications like Kxalate, you can buy the body some time for potassium excretion. Often, intravenous regular insulin and nebulized albuterol are given to help shift potassium from the bloodstream and into the intracellular space. This is not a definitive treatment because the excess potassium is still inside the body. The only difference is that it has moved to a different compartment of the body. When giving insulin for hyperkalemia, it is important to ensure the patient has a safe blood glucose prior to its administration. If the blood glucose is not high enough to support insulin administration, IV dextrose is often administered alongside the insulin to prevent any episodes of hypoglycemia. Calcium gluconate may also be used during the management of hyperkalemia due to its buffering effects on the heart's response to hyperkalemia. By administering calcium gluconate intravenously, we can lower the heart's threshold for arrhythmias and keep the patient safe long enough for dialysis or excreting potassium through the GI tract. When administering calcium gluconate, it is important to have a well-functioning IV, as the extravasation of calcium can lead to tissue necrosis. Thanks for watching. Don't forget to check out the official Emergency Office Hours website and social media accounts. And if you found this video on hyperkalemia helpful, tune in again next time for more Emergency Office Hours.